friends, in this today's video I will talk about Hetastarch, that is hydroxy starch. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice, and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and this information should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand, company, or product. Hetastarch or hydroxy starch is a synthetic colloid starch that is available as 6% solution in isotonic saline. It is composed of more than 90% of esterified amylopectine. This esterification retards the degradation, which leads to longer plasma expansion. 6% hetastarch is normally used and it has a molecular weight of 450,000. After IV infusion, hetastarch molecules with low molecular weight, that is about 40% of the dose, are readily excreted in the urine in 24 hours. Larger molecular weight fractions, they are metabolized and eliminated slowly. Hetastarch expands the circulatory plasma volume in a similar way as serum albumin and dextran does. It has a calculated osmolarity of 310 milliosmol approximately. Hetastarch is slightly more potent than 5% albumin as a colloid. It has a higher colloidal osmotic pressure than 5% albumin, that is 30 versus 20 mm respectively, and it causes greater plasma volume expansion up to 30% greater than infused volume. The expanded plasma volume may last for 24 hours. The advantages of hetastarch are it is non-antigenic or fewer antigenic properties as compared to dextran. It does not interfere with the blood grouping or cross-matching. Hetastarch is less expensive than albumin. Plasma volume expansion is greater than 5% albumin. It expands the plasma volume for a longer period and its effect lasts for about 24 hours. The disadvantage is that it causes increase in serum amylase concentration during and 3 to 5 days after discontinuation of the hetastarch. So serum amylase concentration cannot be used to diagnose acute pancreatitis during this period. Like other colloids, it has no oxygen carrying capacity, so one should not allow hematocrit to fall below 30% after the infusion. The indications for the use of hetastarch are it is safer and effective plasma expander which maintains blood volume for a longer period, and so it is indicated to correct the hypovolemia and shock. For short-term rapid expansion of the plasma volume in conditions such as shock or impending shock due to burns, surgery, hemorrhage or trauma, in these conditions we can give the hetastarch as a plasma expander. The contraindication for the use of hetastarch are similar to that of dextran, and these are chiefly the bleeding disorders, congestive heart failure, or impaired renal function. The adverse effects are very less with hetastarch because it is not antigenic. However, few allergic or sensitive reactions can occur in the form of vomiting, feverishness, urticaria, or wheezing. Anaphylactic reactions are extremely rare and the incidence is as low as 0.0004%. How do we administer hetastarch? The dose of hetastarch depends on the patient's need, and the usual adult dose of hetastarch 6% solution is 500 ml to 1 liter, and the total daily dose should not exceed 20 ml per kg. Sigmund Freud has said, do as much as possible for the patient and as little as possible to the patient. With this, I conclude my today's topic. Thank you. Keep learning.